Melasma can be a really frustrating and confusing skin condition. And today I want to talk to you about what it is, ways that you can treat it both professionally at home, and some things you can do to prevent it. So first let's talk about what it is. There's 3 different types of hyperpigmentation. There's UV damage, which is caused by the sun. There's post-inflammatory hyperpigmentation, which is caused by acne. So the inflammation from the acne will leave behind the dark spots or some kind of trauma to the skin. And then there's melasma. And melasma is hormonally induced. So a lot of times what you'll hear is they call it the pregnancy mask. For obvious reasons, when women are pregnant, they're hormonal and they tend to get dark patches on their face. Melasma is characterized by usually larger brown patches on the face, and it's usually with a defined border. And you'll see it on the forehead, on the cheeks, and sometimes over the lip in the form of a mustache. I always tell my clients that melasma is actually really hard to treat. It's not that it's not doable, but it is difficult because it is hormonally induced. So whether we can or cannot fully lift the hyperpigmentation caused by the melasma, it's still really important to treat the overall health of your skin. So you can still have nice glowing skin and prevent aging and fine lines, and still, work on ways to lighten the skin and certainly prevent it from getting any worse. So the way that you want to treat melasma, like any hyperpigmentation, is 2 ways. You want to use things called ingredients that are called tyrosine inhibitors. Tyrosine inhibitors are going to block the production of melanin. Lactic acid is an example of a tyrosine inhibitor. And then the other way that you're going to want to make sure what you're doing is, if you think of your skin in layers, you want to pull it out and slough it off. So you're going to need ingredients that are going to speed up your cell turnover, like growth factors and different types of acids that are going to help exfoliate the skin. So it's going to speed up the cell turnover and slough it off. And through a series of treatment and over time, you're going to be able to pull out that hyperpigmentation. Other ingredients like vitamin C and retinol, they're great for brightening as well. And another topical ingredient that you can use that will brighten is hydroquinone. You can use hydroquinone safely for a few months, and then you want to go off of it for a few months. Over the counter, you can probably use it on a more steady basis, but if you do get a prescription from your doctor, they're going to tell you to go on and off of it. The safest way to treat hyperpigmentation, in my opinion, is through treatments like microdermabrasion, medium depth multi-acid TCA peels, microneedling, and dermaplaning. These are different ways of gently exfoliating your skin and infusing active ingredients that are going to do what we just talked about, which is suppress the production of melanin, but also brighten the skin. You can use lasers, and I just caution people, if they do use laser treatment, it is a lot of heat and trauma on the skin, and you already have a propensity to hyperpigment. So using a laser to treat melasma can be successful, but you run a really big risk of further hyperpigmentation. So my recommendation is to use the other types of treatments first, and if you're not getting success there, you can talk to your dermatologist about laser treatments, but understand the potential side effects. In our product line, there are things that you can use to treat your melasma at home, including our dermaplaning tool, our multi-acid TCA peel, the microneedle, and our growth factor serum. All of these products are going to help do what we just talked about, which is suppress the production of melanin, speed up your cell turnover, and exfoliate your skin gently while infusing active ingredients that are going to brighten. A few things that you can do to prevent further hyperpigmentation is making sure you use an antioxidant under your SPF during the day, and make sure that your SPF is a broadband UVA UVB with a minimum of 30. So melasma is typically affected by those with darker skin tones, Asian and Middle Eastern women. But I do every once in a while see it with lighter toned skin. Typically what happens with that is they usually have a small percentage of some ethnic background that is causing that production of melanin, whether it be Native American or Asian. It's also obviously, because it's hormonally induced, predominantly a female issue. However, I have seen a small case of male, and it's usually less than 10% of the population. I know melasma can be very frustrating and make you self-conscious, but what I always tell my clients is that it's really important to treat the overall health of your skin. And your melasma may lighten and may darken again, but what's really important is to treat your skin with regular exfoliation and infusion of active ingredients so that the texture of your skin is healthy.